I want to talk to you about never events. I did think of doing a lecture on this, but I don't think it would really work. It's more of a thing we need to talk through together. Now, a never event is literally that. It is an event which should never happen. It should never happen. Because these events, these adverse events, should be completely preventable. They should be wholly preventable as long as we follow the guidance and the safety recommendations set out for us at work in any form of healthcare. So we do tend to spend a bit of time doing the same thing over and over again, checking the patient's name, their date of birth, are they allergic to anything. But that's good, because if we do it the same way every time, we're going to get it right every time. So we need to follow guidance and safety recommendations, because these things provide systemic protection. The whole system works like this. Everyone does it the same. The systemic protection for the patients, to keep the patient safe, but also for us, of course, for our mental well-being and our professional well-being. So there's barriers at national and local level to prevent these never events that should never happen. Now, if a never event does happen, they do happen. When never events happen, they shouldn't happen. But when they do, there's the potential for serious harm to the patients and indeed extreme stress for us. So what sort of things are we thinking about these never events that can happen, sometimes tragically do happen, but should never actually happen? Well, one is surgery site, getting the wrong site for surgery. And these things just make you squirm to think about it. Can you imagine a patient going for surgery and the wrong leg is amputated? So, of course, there's stringent procedures in place to prevent this from happening. When I worked on theatre, we spent a lot of time counting swabs and instruments. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. You count them in, you count them out. Same every time. Because we don't want to leave any swabs or instruments in a patient's body cavity, for example. Neither do we want to give the wrong prosthesis or the wrong implant. Just makes you squirm to think about what could potentially go wrong. Chemotherapy route is another one. Chemotherapeutic agents are very potent drugs, and we don't want to give them the wrong way. So, for example, we don't want to give them intrathecal into the cerebrospinal fluid when they should be being given intravenously. Another unthinkable mistake is giving the wrong dose of potassium. Now, a bolus dose of potassium intravenously it'll kill your patient. It will upset the electrical activity in the myocardium, cause cardiac arrest. So we have to give the potassium via the right route and the right rate and the right dose. If any of these things go wrong, then there's potentially fatal side effects, but these should never happen. They're never events. In fact, it's the same with all drugs. We always have to have the 5 rights, the right dose of the right drug to the right patient via the right route at the right time. These always have to be correct. So, for example, if we've got the wrong route, I've already mentioned we could give something epidurally, which could be tragic. And if something's supposed to be given orally, we have to have measures to make sure we don't give it intravenously. Nasogastric tubes are another one. That if a nasogastric feed is incorrectly given through incorrectly or correctly given even through a incorrectly sited tube, if the tube's going into the trachea and not into the stomach, again the consequences are unthinkable and fatal for the patient, as nasogastric feed would go into the patient's lungs. I remember once realising it was possible on intensive care when I was working there to connect the nasogastric feed to the central line. Theoretically, it was possible with the type of connectors we were using at the time, so I had to instigate a way of making sure that could never happen. So the right route of drug, always essential. We have to check the right dose, make sure it's the right drug, make sure it's the right patient, we're not misidentifying the patient, and make sure we're giving the drug at the right time. And there's a couple of drugs which are classic for causing potentially serious problems. One is insulin. Now, insulin is 100 units per mil. So make no mistake, a mil of insulin is more than enough to kill you. So That's why we always have to use the correct insulin giving equipment and not use normal syringes for insulin. Because if you give 3.6 mils of insulin instead of 36 units of insulin, that will kill your patient. So be very careful with insulin, very potent drug. And another classic one is opioids. As we give more opioids, the patients become tolerant to it. They can take a higher and higher dose of opioids. But if a patient's opiate naive, then relatively small doses can have large effects on them. So we have to make sure we get the dose absolutely right. And a classic mistake that's sometimes made here is people just get the decimal point in the wrong place. So instead of 5.0 milligrams of morphine, people have mistakenly given 50.0 milligrams of morphine. Suicide prevention is another one. We don't want patients to commit suicide, so look around the ward for potential dangers that patients could actually commit suicide, especially in the psychiatric situation, but by no means limited to the psychiatric situation. And it's the same with falls and bed rails. We don't want the patients to strangle themselves in bed rails. Another one is ABO blood compatibility. Transfusion mismatch hemolytic reactions if the patient's given a blood which is not ABO compatible. Again, it should never happen, but unfortunately it has happened. Same with transplanting organs, they have to be ABO compatible as well. Another event is administering the wrong gases. We don't have too many gases in the clinical situation, maybe nitrous oxide, Entonox, sometimes carbon dioxide in the anaesthetic situation, oxygen and air, but we've got to get them right. Again, it should never happen because the fixtures are specific to the particular gas, but tragically, as we've noted, never events do actually happen. Another one is monitoring oxygen levels. If patients aren't properly oxygenated, they'll become hypoxic, and that can, again, obviously is a life-threatening situation. So if a patient's had an overdose of opiates, for example, that might cause respiratory depression. So in patients that are chronic CO2 retainers, we want to prevent hypercarbic respiratory failure through the oxygen levels being too high. So we want to maintain their saturations at 88 to 92%. In most other people, we want to maintain the saturations between 94 and 98% oxygen. Another unthinkable never event is an air embolism. When we're running through drips and intravenous infusions, every piece of equipment has to be primed. But I have actually come across a situation where an intravenous infusion device was connected without priming the giving set. Fortunately, it was stopped before the infusion was started, but that would have caused a huge, potentially fatal air embolism. We have to do these things meticulously every time. We cannot have an air embolism in one of our patients. Patient misidentification is another one, that the wrong patient is identified for a procedure. So we should always check the first name, the last name, the date of birth and the hospital number, the 4 checks. I sometimes check their address as well. Make sure we don't misidentify the patient, get the wrong patient. Scalding is another one through hot baths or hot water. Patients should never be scalded in our care or damaged in our care in any way. So these are never events, and tragically they've all happened. HIV has been spread in many parts of the world through non-sterile equipment, things that just should never happen in healthcare, yet they do happen. So look around your clinical area, look around your specialism, and think about what events could happen, and always make sure you're following the procedures and the protocols so these events don't happen. Keep your patients safe and also prevent yourself from a lot of potentially prolonged stress which is adverse to you and your professional career. Let's never have never events.